Hi everybody, I'm Dr. Aldrich. I'm with the Low Country Clinic. I'm a chiropractic orthospinologist. I'm the only doctor in all of Charleston that does what I do. There are only between 300 to 400 doctors in the whole country that practice orthospinology. It's a very specialized sector of our chiropractic population where what we do is we use math and engineering principles to be able to treat the body. Let me explain that to you. On this chart, your atlas bone is the top bone in your neck. It sits right up underneath your skull. When this atlas bone comes out of position, what it does is it causes a chain reaction all the way down your body because it's trying to balance your head. What happens is that as the atlas moves out of position, what it does is it creates head tilt. The head tilting off to the side will cause a mechanical imbalance all the way down your spine. Also what it does is it pinches your spinal cord. When you pinch your spinal cord, what that does is that pinches off the nerve flow from your brain to the rest of your body. And that can cause a variety of different things, one of which is going to be spinal pain. Also, when this bone comes out of position, it's going to cause pressurization to your spinal cord. And when you pressurize that spinal cord for an extended period of time, that can cause neurological issues, numbness and tingling, neuralgia, headaches, and a variety of other things. When we're looking at the whole body and how this affects the whole body, when this atlas comes out of position, the head will tilt off to the side. Now what you have to understand and realize is that the head weighs approximately 15 pounds. So many times I tell folks that it weighs as much as a bowling ball. Now if you've ever held a bowling ball for an extended period of time, you realize that it's heavy. But when that atlas and it tilts your head over to the side, it's like holding a bowling ball out pretty far. And what happens is that the rest of your body has to react to hold that weight up. So looking back at the chart and what happens with your body is that when the head tilts, it creates an uneven shoulder because there's torque which is introduced into your spine. Now, many people, when they look in the mirror, they'll notice over the course of time that their shoulders never seem to line up properly. Or they could have pictures that are taken with family and they realize, man, I'm just never straight. My head's either tilted or turned, or my shoulders are off center, and there's a reason for that. The reason is because this little bone is out of position. When the shoulders tilt, it creates more torque all the way down your spine, which focuses all of the upper portion of your body. All of that weight is going to be cranked right down here in the lower back. So as we have atlas related problems, it not only can create neck problems, headaches, deterioration, but it also can cause issues, pain, deterioration, and disc issues in the lower back. Also, when this bone comes out of position and the head tilts, you'll have an uneven pelvis where your one hip will be higher than the other. Now, a lot of times when patients come in and talk to me, they'll say, yeah, I've been to another chiropractor before, and he said, or she has said, that I have one hip higher than the other, but will never tell me why. Well, here's why, folks. When the weight distribution is not correct in your spine, those hips are going to tilt because the muscles are tight. When the hips tilt, guess what it does? It's going to create a short leg. When your leg gets short, that means you're going to walk uneven. So many times patients will come into the office and I will let them know that they have a short leg and they'll say, oh yeah, my medical doctor told me I have a short leg. The odd thing is that only 5 to 10% of the US population has an anatomically true short leg. Everybody else who has a shorter leg has a leg that's short because the mechanics of the spine have created pelvic lift. It's creating that short leg. Now, what's the problem with having a short leg? That's as if you're walking around with one high heel on one foot and a flat on the other, and you're going to walk off center for every step. Now, you may not limp, you may not actually feel it, but over the course of time, what you'll develop are going to be knee problems and hip problems, and they'll show up out of nowhere. Many of our patients get knee and hip relief because we rebalance the body. Let me show you how. As an orthospinologist, we analyze this bone to find out where it's sitting and what the proper position of it is and where it's sitting for you. What we do is we correct the position of this bone. That rebalances your head over the top of your body. When that happens, your shoulders level out, your hips will level out, and your legs level out, and your body becomes balanced. All of the pressure that's been exerted onto your neck, causing neck pain and headaches, onto your middle back, which can cause breathing problems, all of that pressure which is causing lower back pain will be absolutely released. When you release the pressure, that is when healing can actually happen. You can never heal your spine, folks, unless you take the pressure off. It's as if you have a cut and you're constantly playing with it. It's never going to get better. So by correcting your atlas position, we affect your body quite literally from the tip of your head all the way down to your feet, helping with headache issues, neck issues, shoulder issues, middle back, lower back, hips, and knees. It's all encompassing for your whole body, and it's very simple. In future videos, we're going to talk about the differences between other chiropractors and us in a much more detail. If you have questions about what we do or how we can possibly help you, please visit our website or you can give us a call. Thanks for your time.